Hi, my name is Tapia Mera Roberto, and I'm a student from the Autonomous University of the State of Hidalgo. And today I'm going to talk about urinary system. Let's begin. Well, the urinary system is one of the 12 systems that make up the human body, and its function is to produce and eliminate urine from the body. Next, the structure, location, general function, and each of the organs of the urinary system will be explained. But what is the urinary system? Okay, the urinary system is a set of organs that produce and eliminate urine from the body. The urinary system is divided into two parts, the upper urinary system and the lower urinary system. The first includes the kidneys and urethras, and the second includes the bladder and urethra. Here we have the female urinary system, and this is the male urinary system. Well, as we say, the urinary system is a set of organs responsible for the production, storage, and expulsion of urine. Heterogeneous waste from metabolism like urea, creatinine, uric acid, and other toxic substances are eliminated from the body through urine. The first organs that we have are the kidneys. The kidneys are located in the retroperitoneal region in the middle of the back, just below the rib cage, and are divided by the sagittal plane into left and right. And the function of the kidneys are remove waste from the blood and excess water in the form of urine, and help maintain the balance of chemicals such as sodium, potassium, and calcium in the body. The next one are the renal tubules. The renal tubules are located deep within the kidneys, and this contains cells that filter and clean the blood. These tubules make urine to remove waste, extra fluid, and other substances from the blood. The next one are the urethras. This one, the urethra half, it is in the abdomen here, and the lower half, it is in the pelvis. And the function are conduct urine from the kidneys to the bladder and perform peristaltic movements. And these are muscle contractions to conduct urine. We have the renal pelvis. The renal pelvis, it is in the center of the kidney, and it is responsible for collecting urine and passing it through the urethras, which are the two tubes that connect the kidneys to the bladder. Urine accumulates in the bladder until it is eliminated during urination. And we have the bladder. The bladder, it's a balloon-shaped organ located in the lower abdomen, proximal to the pelvis. And its function is store urine from the kidneys until it is eliminated from the body. The urine. Its function is to eliminate toxic substances such as urea, drugs, alcohol, creatinine, uric acid, and other toxic substances from the body. And it controls blood pressure, acid-base balance, and sodium and potassium excretion. Prostate. This is a gland that it's only from the male body, and it's located just below the male bladder. And its function is along with the testes and seminal vesicles produce semen. And it is crossed by the urethra, which connects the bladder with the outside through the penis and allows urine to be evacuated. The next one is the male urethra. The male urethra is a tube that allows urine and semen to pass out of the body. In men, the urethra is a long tube that runs the length of the penis. And we have too the female urethra, and this is a conduit through which urine passes in the final phase of the urinary process, from the urinary bladder to the outside of the body. And in women, it is much shorter because it's a route, it's firmly attached to the wall of the vagina. And the penis, it is located above the scrotum, and it's only in the male body. And it's a male organ used for urination and sexual intercourse. Well, we're going to talk about some disease. We have this cystitis. This is the inflammation of the urinary bladder. Causes the kidneys don't remove waste from the body well. Effects are burning when urinating and blood in the urine. Prevention, drink water and keep the genital area clean. And the treatment are medications administered orally. We have the urethritis, and this is the inflammation of the urethra. The causes, mainly for sexually transmitted disease. The effects of urethritis are pain and burning when urinating and frequent or urgent urination. The prevention, practice sexual intercourse with caution, and the treatment, antibiotics and analgesics. The kidney stones, these are small hard deposits that form in the kidneys. The causes, they don't have a definite cause. The effects of kidney stones are acute pain on the side of the abdomen and nausea. Prevention, drink more water and other liquids. And the treatment, painkillers and drinking lots of water. And finally, renal insufficiency. This is when the kidneys cannot remove waste and balance fluids. The causes are kidney injury and autoimmune disorders. The effects, decrease urination, fluid retention, and causing swelling. The prevention, healthy diet, do exercise, and do not smoke and drink alcohol. The treatment, medicines and dialysis or kidney transplant. Here we have some fun facts about the urinary system. Number one, nerves of the bladder. These nerves tell you when it's time to urinate or when your bladder is empty. Number two, the bladder can store half a liter of urine for 2 to 5 hours without causing discomfort to the person. Number three, urine is made up of 95% water. The rest is 2.5% urea and 2.5% salts, minerals, and other enzymes. Number four, in the bladder, there are muscles called sphincters that close tightly to prevent any spontaneous leakage. And number five, adults pass about 1.5 liters of urine per day. Well, as we can see, the urinary system is a complex and very interesting mechanism. As long as you follow healthy lifestyle habits, your body will have no problem removing waste from the blood. And remember that in case of pain or problems when urinating, you should consult a urologist, as it could be a sign of a medical condition that needs timely treatment. And well, that's all. Thanks.